So I've got loads of questions just coming in. I don't know where to start. So let me start from the top. So before I start doing Q&A, I've got von Willebrand's type 3 as a male, and I participated in 3 trials, and one of them included Relate, which I'm sure many of you know. So I was one of the first participants in the United Kingdom to take Relate. The reason I took it, while many people are worried about trials, there's nothing to be worried about at all. You know, a lot of my trials, without doing a trial, I wouldn't have known whether the medicine was working. And without participation in trials, the medicine will never reach out or come out. So it's so important for us as VWD patients to be involved in trials. And I know it's scary, but that's why the VWD Alliance are here for you. So we've been there, we've gone through it. So let's start with the first question. And it came, I'm going to start asking some questions from those who have been on this call specifically, and then we'll pick a couple of the ones that were asked prior to this meeting. So Catalina asked, type 2s, talking about joint bleeds. How can we recognize bleeding in the joints and muscles? Who would like to answer that for Catalina first?
I think people who have had joint bleeds should answer that one. I can tell you from a physician that we ask people to trust themselves. So I tell people that if you think pain, swelling, or something is odd in your joint, and you know you have a bleeding disorder, to back yourself and come tell your physician about it. For people who are used to having recurrent joint bleeds, it's more easy to recognize and know your symptoms. But we're finding out with our natural history studies that actually probably quite a few people are having musculoskeletal and joint bleeds. It's not just the haemophilia von Willebrand's disease patients. So I think pain, swelling, but also just something's not right. Trust yourself and get someone to have a look at it. But Sunny, you're going to be a better person to answer this question than I am.
Yeah, I think one of the easiest way to recognize von bleeding. A lot of times, what we get for is people say, "Oh, it's not von Willebrand. It must be osteoporosis as you get older. I'm a 40-year-old man." The truth be told, many a times it's not. It's caused by what we class as microbleeding. So while more research needs to be done, I can 100% know when something's gone wrong, because where I've got my joint bleed, i.e., let's say my ankle, it starts to swell up. It starts to get warm to the touch. When you start to wake up and feel achy in certain areas or sore, a lot of times, especially with type 3 von Willebrands or type 2s, it doesn't matter whatever type you are, a lot of von Willebrands is underneath the skin. And that's the problem. And that's kind of why we do push for this world of prophylaxis for von Willebrand, regardless of your type, because we believe in VWD Alliance, you're not defined by your type, you're defined by your bleeding. And it's asking those questions like you said, Dr. Catherine. So Pankaj had a couple of questions. I'm going to ask, there's one specific one that he wanted to get answered. And both him and his daughter have been diagnosed with type 2A. So Emma, maybe one for you as well. And they're from Bangladesh. They had to visit India to diagnose, and they wanted to know a little bit more about 2A, Emma, from yourself. Could you give them maybe like a 30-second to a minute kind of description of just generally how life is for you?
Yeah, so for me, so I've got 2A. My levels, and I don't know the millimoles and decimoles and all of that, but I am 0.04. And then when I have my prophylaxis treatment, I go up to 80%, which is my understanding is within the normal range. But I have lots of nosebleeds, lots of mouth bleeds. Every single time I brush my teeth, I have a mouth bleed. So that's twice, 3 times a day sometimes. My periods are very heavy. Piggybacking on what you were just saying, Sonny, about joint bleeds, I have had joint bleeds, but was told as von Willebrand's, you can't have joint bleeds. Mine specifically, if I've gone bowling, my knuckles will be double the size because it's literally just the weight and the trauma of the bowling ball. My knees, I've had joint bleeds in my knees and some big bruising. I saw about you asking about surgery. So me personally, I've had my wisdom teeth taken out. under general anaesthetic. And I had internal bleeding as a child, and had a endoscopy procedure for that.
Yeah.
Both lots of treatment. Oh, sorry, and I've had an operation on my foot as well. Every surgical procedure and dental procedure I've had treatment beforehand and treatment afterwards. It's been an overnight admission, maybe a day or so in hospital, where they made, I think with my foot, I had 2 lots of treatment afterwards, and then tranexamic acid for the week following. But obviously, I would discuss with your haematologist your specific treatment for your operations and your bleeds.
Absolutely. And a question came both prior to this seminar and during this seminar was, can the severity of systems, and funny enough, we were talking about this as a part of VWD Alliance members, can the severity of symptoms vary based on climate, cold versus tropical? Does it have an impact? It'd be good to understand from a clinician's perspective, but also a VWD patient's perspective as well.
So I think yes.
Can you elaborate?
So the video that I posted last week on Instagram, that was during our lovely heat wave that we've been having in the summer, and I think that was literally just caused because it was so hot. But then I visited Florida a few years ago, and I went in and out of the air conditioning in their lovely buildings in America, and every single time I went back inside the air conditioned room, my nose would start bleeding. So I definitely think temperature and the humidity and things contribute to bleeds.
I 100% concur. I remember going to India, and I went to go see my family in the Punjab, and I never bled so much because of humidity. It was crazy.
Yeah.
Trying to do an injection in 30 degrees plus heat is quite a challenge. Itself.
I just shoved the tampon up my nose because I was like, I don't know how else to squeeze my nose and do my injection.
That'd be a very interesting thing to explain to Indians about that as well, especially my family members. But Dr. Catherine or Jigar, do you want to answer that as well?
I completely agree as well, and I think particularly in the nose. So in the cold, when you kind of get dry and mucosa and it gets a bit crusty and you get a bit of a snotty nose in the winter, that's a recipe for disaster as well. And then of course in the heat, the blood vessels expand because you're trying to cool yourself down, and if you've got just a little tender point, it can really encourage the blood flow. And so I definitely see it with muco, keeping your nose and mouth. Other bleeds, I don't know, or maybe there are patterns, but I haven't seen it myself. And interestingly, we don't have good data to tell us one way.
No,
it's,
we don't.
You would have thought it's definitely out there. And then another seasonal thing to mention is, I know that the haemophilia community have looked at sports seasons and activities, and summer holidays as a time for traumatic bleeds. And I suspect we also see, seasonal, not just from the weather, but from the annual activities. There are times where there's greater risk for kids and adults. And so I definitely believe in a seasonal effect of the football season.
Yeah, and I definitely think there's something to do with taking your medicine prior to doing an activity. As a child, I never listened to my doctor, and now I'm 40-year-old. I wish I listened to my doctor. Take your medication before you do football or any exercise. It will help you and your joints in the future.
But that's a really interesting thing you raised, because for most of the patients with von Willebrand's disease, I don't have something I can say, yeah, it's fine for you to go and do football. If say you're a child with 2A and you're not having regular prophylaxis, you don't quite need that. What do I tell you to do to protect your joints, stop you getting a great big hematoma, and make sure you're engaging with all those social and support and important sports activities? Because that's just not a tool. What am I going to tell them to take? So I think that's a really important thing. If you're on prophylaxis, you can use it to really make sure you're taking all those opportunities. But there's this big gap in the middle for people that what would you tell that kid to not take part in those activities? It's a really hard one.
What do you think of, someone asked a question about high altitude, and I remember when I was young and I was meant to go to a trip, and one of the doctors prior back then, I'm showing my age now, 30 years, 25 years beforehand, I wanted to go up a hill, and it was quite high altitude. It's like not K2 as much as tall as K2, but one of the smaller ones. And I was told not to, because that I would have a nosebleed due to high altitude. What's the data around that? Do we have anything?
I bet there is data. I suspect that yeah, I wonder if the pressure changes and all those environmental factors contribute. But also on top of that, if you were going with if you were going with a bleeding disorder society, I suspect they'd be very supportive. I suspect if you're going with a school group, people make excuses to not take that kid that they're worried about might have a bleed at the top of a mountain. So I think there are two factors. Yeah, there's probably a physiological element. I worry as well that people withdraw opportunities because they don't quite know how to manage or cope with it. So yeah.
No, absolutely fine. And Jigar, we've got a couple of questions for you, my friend. So there's two questions that have come up, which I think you can answer. One was from Jolene. She said, is this study available for pediatrics as well? My daughter is 14 and her treatments are even more limited.
Yeah, so fortunately, I think typically what clinical trials what would do is you start in adults population, so 18 and above. And then as you get additional data, you would move down into adolescents. Having said that, the Valora Discover trial is open for those above the age of 16. And then the Valora with HMB-002, Valora Pioneer is 18 and above right now. So our hope is that as we progress, we would certainly aim to move down to at least above 12 and above, but not currently there yet.
And Kim asked, do you have to infuse with factor products if you have a breakthrough bleed when using HMB-002?
So very good question. Right now, based on the mechanism of action, there's still full functionality to be able to use any of whatever is your standard of care. So whether you're using TXA or antifibrinolytic, whether you're using DDAVP or factor, one study that was done by our research group was that when you give a factor product, in addition to having HMB-002 on board, it actually extends the half-life by threefold. And so there's still a possibility to give it, but we would just give a different dosage or potentially different frequencies than as you typically might have given it. And I'll let Catherine add on too.
You actually said exactly what I meant to say, where it's because everybody's treatment is different. Before they come onto the study, we go through with them and their physician what would be the plan if they had a breakthrough bleed, so that everybody knows what to reach for and it's kind of personalized to them. But exactly as Jigar said, if your levels have gone up, you might need less factor. If your factor lasts longer, you need less frequent doses. So there's a way, there's a protocol for measuring and adjusting the doses for each patient in the study. But it's quite helpful that we can use all those different tools in case people have breakthrough bleedings on the study.
I agree, and also as a VWD patient who's been through the rigmarole and years of having von Willebrand's, I kind of go back into the whole necessity of being part of trials. I'm not saying it lightly. I'm saying if you don't get involved, or we don't get involved as a community, the problem is we're never going to get the data. You don't get the data, the new drugs won't come out. It's as simple as that. It's quite difficult to explain to people about that, and it is one of those things that as a VWD Alliance, that is what we're trying to educate von Willebrand patients, and we're trying to create a community. Yes, Kat.
I actually have a question for Jigar, if I may. You obviously mentioned that HMB-002 is subcutaneous. Do you know yet what that would look like? Obviously, I mentioned in the introduction that all the current therapies are intravenous. So what would that look like if obviously the trials will go well? What was the subcutaneous, how would one administer that?
Yeah, so it's just it's a much shorter needle that is administered. So an IV, you're certainly trying to get into a vein, so to speak. So you need to and infuse a much, well, in this case, a larger volume. what we're talking about with potentially HMB-02 is less than 1 milliliter of drug volume that you can actually put into either you're trying to find an area of your body, so just sort of like the pinch and inject, and that would ideally be right under the skin. And yeah, if you've seen anyone take insulin shots, for example, it would be similar to that. And yeah, so that would be what subcutaneous administration looks like, and it would be able to be done at home.
Great, thank you.
And just to add, the difference in the difference in training needed between IV and the setup and the safety of giving IV versus pinch a love handle and pop a needle, and it's just the amount of support patients need is far lower, and you can be up and away and running. There are lots of anticoagulant drugs and insulin. There are lots of things on the market that use that, and we generally give patients one training session and a number to call if there's a problem, and away most people go. So that would be, it would just decrease that burden on the health providers and the service and the nursing staff and the home support as well, if we can develop tools with this subcutaneous versus the intravenous route.
And Hardeep's asked a question, and actually it's something I wanted to ask as well. So, well, good question, Hardeep. HMB-002, Jigar, will it target type 3 in the future? And when are we likely for it to come out globally?
Yeah, so as I mentioned, I think some of our research team has looked at actually if HMB-002 is on board, you can actually extend the exogenous factor VWF levels by 3-fold. So to answer your question specifically, our view is that HMB-002 can potentially be almost like a backbone therapy of sorts, where you can use it across various subtypes, type 1, type 2, certain type 2s, and type 3, depending on how much VWF you have in your body, because our drug responds to what's already in your body. You might need a little bit of exogenous, or what they like recombinant VWF infused, if HMB-002 is on board, and allow it to function a lot longer. So let's say potentially for a type 3 von Willebrand's disease patient, they may be taking 2 times or 3 times IV VWF as prophylaxis. With this HMB-002 on board, could that potentially shift to once a week IV or once every 2 weeks? Those are the sort of trials that we'll do in the future. In terms of when exactly we think it'll be available globally, very difficult question to answer, because we still need to go through all of the trials, and drug development is never sort of a linear line. So I think I can safely say it'll be a couple of years. I can't say an exact date of when we think it'll be available. But our aim is to make the trials available globally as best as we can.
And are the trials, just so everybody's here, because we've got quite a global community on this call. I understand the trials at the moment are based in the United Kingdom, Australia, and USA.
United States.
Are the 3 areas. What other areas are you looking to explore? Are you looking to explore India, Japan, and other places coming up? What's the next stage for you guys?
Yeah, so right now I think we're hyper focused on enrolling in those particular areas, given that the logistics of setting up a trial and the time setting up a trial are very, very long. In this particular phase, as we move to the next phase, we'll then expand into where else can we open up this trial globally. And so that we'll do a whole assessment of where we can open up the trial, how quickly we can open up the trial. What is we would need a willing physician to be able to be interested and be the lead investigator in those countries. So all of these factors will go in, and we'll aim to expand it, but not a definitive country list thus far.
But it could be a global product for the future, potentially.
Yep.
Brilliant. And Pankaj has asked a question about his daughter and we may need to just go into a bit more detail for him. He explained that his daughter has experienced nose bleeding during summer, winter months, the months that we were talking about, the change in temperature. Is there any kind of advice, and this could be to Emma and Kat, you've grown up with Von Willebrands as ladies. Is there anything, she's 12 years old, is there anything that she needs to have precaution, especially because she's just about to enter her period as well? Any advice for them?
So I would definitely, if sort of looking back, I would definitely push earlier if you're having heavy bleeding, and not accept the, well, that's normal answer, and push a bit more for contraceptive pill, Tranexamic, whatever treatment option is the best. But in terms of just day-to-day coping with a period, in the school bag, I always had a spare set of knickers, and if I could, either like my PE shorts or a pair of spat trousers or something like that, loads of pads, some paracetamol, things like, just the day-to-day coping of a period. But then because I had to be aware I could flood out, I needed spare clothes. Some schools here in the UK, they don't let you have things like paracetamol and Tranexamic in your bag. You have to go to like the school office for it. But if it's a letter written by your haematologist that you need your Tranexamic near you, that could hopefully be organised. But again, it's opening up those discussions with your haematologist.
Yeah, I think I would echo what Emma has said. So I was very fortunate in that VWD type 2B runs in my family. So my mum knew exactly what I was going through because she went through it. And so as soon as I came on my periods, and they were pretty rough, she got me to the GP and asked for the pill. And I hear what you're saying, Emma, about, they think you're sexually active at like 11 or 12, and you're thinking, no. Well, I was really fortunate with my GP. He understood, and my mum could advocate for me, which just shows the importance of patient advocacy. They really helped. After having children, obviously you're talking about kind of first periods, but after having kids, my periods were just twice as bad after my second child. So actually the IUD, the intrauterine device, was life-changing for me. And just a word of warning, I know there are some Facebook groups that one in particular advises against the use of an IUD, and I would just caution everyone in this call to please do your own research, because actually time and time again women with VWD will tell you that IUD can be absolutely life-changing. So please, I know we do use social media as a VWD Alliance, but please don't just look in one group, look in other groups and ask people. Yes, Catherine.
No, I wondered if this young lady wants to go and talk to someone, connect with other young women, to go through mum and dad and ask questions. Where have you found, other than VWD Alliance, where else would you recommend that she goes for kind of peer support?
So like Kat, I've got quite a good family network. So I spoke with my cousins, I spoke with my auntie about what they experienced. But I would say social media, that is the way that the world is going. So, connect online with people in your area if you can, and ask for local people's advice as well as us here at the VWD Alliance.
One thing, if I can add, going back to the young girl who's starting her period, I was very fortunate and had a very close group of friends. I was very open with them about the fact I had VWD, and so it made a huge difference when I was, at senior school, being able to go to a friend, can you just check my skirt, like just walk behind me a few meters, just because actually it's, all these things you take for granted. Actually, my friends didn't ever experience that, but I was really open with them, and I would encourage others. We need to get the conversation started. Actually, we need our friends to know what von Willebrand disease is, so they can tell their communities, and so on and so forth. We need to actually wear it proudly.
Yeah, no, I agree with that. It takes a little bit of confidence, especially a lot of doctors are male. So you're sitting there with 2 or 3 male doctors, and then your dad next to you. and you're 12, 13 going, need to talk about my periods, but there's all these men. It's really hard to do, but you just need to find that little bit of confidence and talk about it to get the help and get the advice.
And that's exactly what this Von Willebrand's Alliance platform is for everyone on this call. What will be happening over the next 12 to 18 months? It takes time to build an online platform. The 3 areas of the platform that we will be looking at, one of the biggest areas is connecting Von Willebrand's patients with other Von Willebrand's patients locally. So you're not ever feeling like you're isolated. On top of that, there will be a kind of library of information of different topics. So there will be a section, an AI bot where you can ask a question, shall my daughter have X, Y, and Z? And it will come up with articles, link with patients, link with your local hematology center, and it will be a centralized place rather than going through everything. Sorry, my internet's just gone. Just one last question I've got around, where was it? Sorry, just bear with me. Is there anything in the works besides genetic testing to help in diagnosing VWD?
Is that one for me?
Maybe, yes, I think so.
So is there anything that works other than genetic testing? Well, interestingly, genetic testing is not very good for lots of types of VWD. People with type 1 von Willebrand's disease, often you can't find a genetic cause, or we don't look in quite the right place, or it's not yet been identified. So definitely there are other things that you need to do beyond the genetic tests, and that's really recognizing. So number one, it's the laboratory testing. You have the right blood test to check activity levels, how much protein you've got, doing it at the right time, and recognizing that little kids and people who are really stressed can temporarily raise their levels. Lots of people with von Willebrand's disease can get surprisingly normal results when they're stressed out. So we've got to also educate physicians to recognize that you need to take time to do these blood tests. So that's very important. And then beyond that, one of the key things in getting people diagnosed and getting towards the right test is really asking the questions about bleeding. It's understanding that bleeding can come in such a variety and different patterns, and to understand what's normal bleeding that anyone can experience versus an abnormal pattern, and putting all of those things together. And of course, family histories are pretty good clue as well.
Yeah, that's so. I was actually, no one in my family has von Willebrand's whatsoever. So, you know, even when they were tested, it didn't show up. That doesn't mean that they don't have von Willebrand's, by the way. You know, many of the women in my family have got heavy periods and they've had issues with early hysterectomies. It just never came up. And I've got type 3, which is I'm a bleeder, as they like to call it. I've got a question, and it's an interesting one. And as we get older, whether you're male or female or whatever you define yourself to be, one of the key things is around, you know, and actually, Kat, you are a research person in cardiology, so it'd be interesting to get your thoughts on this, is around the point of when we get older, it is how is the treatment for arterial fibrillation typically treated with antiplatelets different in patients with VWD, if at all? And with a HMB002 perspective, Pat, on, will it have any effect on that in the future?
So I'm going to say straight off the bat, I don't feel qualified enough to answer that. So my background is in cardiovascular research. I was focused on ventricular fibrillation, but I'm gonna back this to Catherine.
Pass it to Catherine. It's easier.
That's a really, really interesting question, and I'm always saying this. It depends on your own personal situation and your background levels. But it's a really good point, because as you age with bleeding disorder, you're going to inevitably have additional health problems, and we would never want it to be the case that you can't have ideal treatment for your cardiac disease, for cancer, for whatever life throws your way, because of the the underlying bleeding disorder. So to go specifically to atrial fibrillation, some people need anticoagulation, some people need full anticoagulation. That's the standard of care if you didn't have a bleeding disorder. If you have very low levels of von Willebrand's protein, it's going to be really dangerous to anticoagulate you. But conversely, if you've got low levels, you're already slightly anticoagulated yourself. So your physician will carefully balance your personal situation, whether you're on prophylaxis or not, how severe your deficiency is, and what exactly the risks of your additional health problem are in order to make a very tailored approach. But it would be a lot simpler if we could correct everyone's von Willebrand's level to normal, or to as close to normal as possible, and then give everybody the same standard of care. So yes, I certainly hope that there will be a role for HMB-002 and similar drugs in the future to make life easier and ensure that everybody who ages with a bleeding disorder gets evidence-based, ideal treatment for their secondary conditions. At the moment, with careful consideration and balancing, there is a way through to offer people an appropriate best solution. But wouldn't it be great if we could eliminate one problem and make sure that you have standard of care, the best option available for everything else, so that your underlying von Willebrand's disease didn't interfere with that?
Thank you so much. Jigar, last question for you, my friend. Are there any risks involved with this study? Can you discuss this with us in a bit more detail?
Yeah, sure. I guess the initial caveat is there's always risk in every clinical trial with an investigational therapy. In this particular case, of course, and as in with every clinical study, there's usually a lot of safeguards put into place. As you escalate dose, there's a safety review committee that has to evaluate the data. That is an independent third party. They're usually physicians that are treating von Willebrand's disease that would allow for some of these things to come into place. So there's always a sort of objective third party. In terms of the risk, it's an antibody-mediated therapy that is aimed to increase your VWF levels. So, what I try to think of is any trial, what it's aiming to do, if you could overshoot it, what risk would that intend? So, in this case, if we're trying to correct von Willebrand's factor, if the drug was incredibly potent and we didn't measure it right and bumps up your VWF to a very, very high level, that of course would be a risk. There's always sort of what I would call like random risk of safety elements. Like you don't know if it's going to cause nausea or vomiting or headache or some of these other sort of adverse events. Those would be the sort of two most logical explanations of what I try to think of. But usually it's the risk are you're trying to take measured risk versus benefit that you may not always know. Catherine, I think you have something to chime in on that.
Yeah, so I always do this. I say exactly what you said in a slightly different way, but I think I was just at the meeting, the ISTH meeting, we presented our data of all the studies we've done before offering this to people to really try and look for where problems might arise, and we didn't identify any. So as Jigar said, the one thing we know about is that we could overshoot, we could go too far, put the von Willebrand's factor up too high, and that's really what we're highly aware that we need to look out for. But with there's the things that we don't know about. We're going into the clinical study with a really good package of support for doing it, but the whole design of the study, how patients are monitored, how we slowly progress through the doses, is all designed to pick up on the unexpected. So when we're doing our blood tests for people on all clinical trials, we'll look at all the different systems, so your kidneys, your liver. Even if we're not expecting to see something, we're always continuously looking to make sure that before we go up a stage or keep patients on the study, that we're looking out for those signals. So yeah, that's exactly what you said, Jigar, but in slightly different words.
Yeah, I think it's important to reiterate. Yeah.
Listen, as somebody who's been involved in 3 trials, and something I always say to all my team, those in the tech world, is the biggest risk is not taking any risk at all. Right? In life, you've got to take risks, and calculated risks. And I've been involved in trials, and it's been wonderful, because without that, you know, would probably wouldn't have been out there without those who did the first trials. So, you know, we have to take those. Now we are coming towards the end, but I did want to answer a question that Heather had. So it links back to genetic testing, maybe for Catherine. So you've spoken about, you know, how accurate are genetic testings? Not always accurate for von Willebrand's. Heather's basically, she's got a son with type 2A. She herself has lower levels of VWD, but it's not diagnosed. Could they have missed it? And, you know, what can she do about it? That's from Catherine, whoever is willing to answer it.
I think Catherine was trying to, but we can't hear her.
Yeah. So that's a really tricky one to answer. So if your son has, if he's definitely got 2A, it's usually inherited. You just need one copy of the gene to have type 2A, not always, and there are other things that can modify it, but generally as a you need one copy of the gene to have 2A. So it's possible that he could have got that from his dad if you've been shown to not carry that gene. However, if you haven't had genetic testing and you've maybe just had a laboratory test and somebody sent you and said it's all fine, just remember the comments before that actually von Willebrand levels can go up and down. Even with people with 2A, they can fluctuate a little bit, not everybody, but it could be the case that you just had blood tests at a time where your levels were a little higher. So if you have bleeding symptoms, you have a child who's got a confirmed diagnosis, maybe the case you don't have the same gene, but if you're symptomatic and it's impacting you, go and ask again would be my advice. I hope that helps and answers the question.
No, it does. Well, look, on that note, I think we will close the Q&A session. On my behalf, I just want to thank everybody for attending this event, for Dr. Catherine, Jigar, Kat, and Emma for your story, and for everyone being here. I hope it's been informative for you all, and everybody's taken something from this. And I have just emailed, if you do want to reach out to us, do email us at hello@vwdalliance.org, and we're more willing to speak to anyone one-on-one as well. And if you want to know more about Hemab, feel free to talk to us as well.
Yeah. So yeah, I would just like to close by saying thank you for each of our speakers. Thank you obviously for giving your time, and I know we're in different parts of the world, so Jigar, it's probably super early for you, so thank you so much for your time, really appreciate it. And thank you also for all the attendees for registering to join us. As Sunny said, we've established VWD Alliance for you, the VWD patients and caregivers. So if there's anything you'd like us to see us do more of, please do let us know. There's a short feedback form that you can access on the QR code, which we will also email across to you. It will take less than 2 minutes, but it's the only way that we can get feedback to know what to do in future. Recording of this seminar will be emailed to all of you, so please do make sure that hello@vwdalliance.org is on your safe senders list, and or check your junk just in case. And if you're not already following us or you haven't joined the VWD Alliance, please do so online. And finally, I know a lot of the time I come up with questions after the event, and so if you need to contact Jigar or Catherine with information about the trial or any more about HMB-002, you can contact them at clinicaltrials@hema.com, or you can fill in their contact form online as a patient or as a caregiver. And so, yeah, I thank you. I just echo what Sunny said. I hope you have a wonderful rest of your day, and hopefully see you at a future webinar or an in-person event, hopefully in the near future. So thank you so much, and we'll see you all again soon.
Thank you all.
Thank you very much.